Dr. Farb, would you like to introduce yourself and tell us a little bit about yourself?
I'm a licensed clinical psychologist, both here in Missouri and Illinois. I've been practicing for approximately 36 years. I did my doctoral work in Chicago at the Illinois School of Professional Psychology. I did my residency in the United States Air Force. Much of my practice is with young adults, adults and older adults. I do some psychological testing, and I do workman's compensation. I work with a lot of the healthcare providers here at Missouri Baptist Medical Center.
So the first thing that I'd like to ask you is, how do you feel like we were doing as healthcare providers before the pandemic?
I have seen a number of healthcare providers, physicians, nurses, nurse practitioners, prior to the COVID-19. And the one concern that people would come to see me about would be professional burnout. My main concern there had to do with their lack of balance in their life. They tended to focus much on their work. Even when they would come home, they were dealing with either lingering thoughts, worries, concerns, had to continue on with their continued education, and there just was not a good, healthy level of family time and self-time.
Yeah. How do you think that we did as healthcare professionals throughout the pandemic?
I think that it's proven itself to be quite difficult. There's been a higher incidence of depression, anxiety, sleep-related problems, social isolation. One of the concerns that people had was what is going to be happening in their future. How bad is this pandemic going to be? Feeling less and less information, feeling a lack of control over their destiny.
How do we cope through this pandemic, or what would you recommend to help improve our mental health?
I think that professionals need to be focused more on themselves, utilize good stress management tools, focus on themselves in regard to making sure that they get a good night's sleep. They set up a sleep schedule, the same time when they wake up, same time when they go to bed at night. They need to exercise, they need to eat right. They need to utilize maybe visual imagery, music, they need to read, they need to pursue their typical normal interests. They cannot be isolating themselves from family or friends. They need those relationships. I think that the medical center administration needs to show them the gratitude that they deserve, that they're appreciated, and to give them as much information as they can, because it'll help the physical healthcare workers feel more in control. Not having enough information will increase their anxiety and worry.
What would you say about those of us, or any of us, that may have experienced PTSD-like symptoms or experiences, maybe in the emergency department or in an outpatient setting where we were dealing with COVID patients?
I think, first of all, healthcare providers need to know that these feelings are very natural and normal. Eventually they will go away. They need to know what the triggers are. It might be a certain event at work, maybe an outside stressor based on, say, something that's going on in their family. That's why I was stressing the need for quality relationships and as much information as possible given to them, and they need to feel appreciated in their work day to day.
Thank you. And lastly, Dr. Farb, are you taking new patients in case any of us need help?
I am, and I am available several evenings a week and Saturdays. I'll be more than happy to provide any support and answer any questions people have.